Thank you so much, Alyssa, for applying for the position of a healthcare administrator in the Pediatric Center here at Robert Wood Johnson Hospital. I just want to start off by asking you a few questions.
Okay, thank you for having me today. Sounds great.
First, I would like for you to describe a situation in which you had to use your oral communication skills in presenting complex information. How did you determine whether your message was received by the audience?
I had a previous position where I had to explain tasks for a physical exam that was required for hire. So, for example, if somebody wanted to work for a railroad company or they wanted to work for a stocking company where you had to do physically demanding tasks, I had to do a physical to make sure that their heart rate and blood pressure stayed the same while they were doing the tasks. So I had to teach them ergonomically how to pick things up and push and pull objects properly and safely, and then they had to perform that for me. So in order to communicate properly for them to do the task properly, I explained the instructions first, and then I did a demonstration, and then I let them practice before we did the exam.
Share an example of an important personal goal that you set and how you accomplished it. Identify if you employed a self-assessment strategy.
Sure. A personal goal of mine is achieving emotional intelligence. As a leader, I think it's very important to be emotionally intelligent so I can communicate properly with my employees. So a self-assessment tool that I used was taking a quiz online to see how emotionally intelligent I am. And from the quiz, they gave me a score and they told me what I needed to work on. And the topics that I need to work on are active listening and self-awareness. And that is something that I learned that I need to work on. And so I practice, understanding how I'm feeling, how my coworkers and my employees are feeling. And I try to practice active listening, which means that I try to be a good listener and listen to listen and not listen to respond.
Perfect. Next, I would like for you to identify situations where you utilized attributes of servant leadership and what were the outcomes.
Sure. I think an example of a time that I showed attributes of servant leadership was when I volunteered for the Special Olympics when I was still studying undergrad. To me, a servant leader is someone who lives to serve the community and make other people happy, make sure they're getting what they need. And so I decided to speak about Special Olympics because as a servant leader, being a volunteer at that event, I was serving the community, the families, and the individuals who were involved in the Special Olympics and people that have special needs. And it was a great outcome. Everybody had a lot of fun. Everyone, got what they needed. And I feel that everyone was recognized and everybody was shown fairness and kindness. And they were all able to perform the activities and have a fun day with their family.
Have you ever had many different tasks given to you at the same time? And how did you manage the task?
Yes. In a previous position, I had tasks given to me that involved helping with patients, helping with the front desk, answering phone calls, ordering supplies, and running anything else that needed to be done. When I had to multitask these, I made sure that if there were tasks that I could do at the same time, I would do those. And if not, I would order them in order of what was most important, what needed to be done first, and what could be done later, and make sure that I get them done in a specific amount of time by giving myself a goal or a time frame when I had to finish.
Last, can you give me an example of a time you had to deal with an ethics dilemma, and how did you resolve the issue?
Sure. I had an experience where an athlete was injured on the field, and I had some individuals in the bleachers who were curious as to what injury occurred to the patient, and they were not guardians or parents of the injured individual. So I had to kind of just explain to them that even though they did know him, if they're not guardian, I can't disclose all the information. I told the individuals that the injured person was okay and that the help that was needed to be given to him was coming, and just calmed them down, but I didn't disclose any information because that would be a HIPAA violation. So that was a dilemma. I think that's something that happens pretty often in the field of healthcare because something might happen, bystanders, oh, that's my friend or that's my neighbor. Can you tell me what happened? You kind of just have to be kind and tell them they're okay, but you just don't disclose any information.
Perfect. Alyssa, I'd like to thank you so much for your time today. We are still interviewing other candidates,
Okay.
But we'll get back to you by the end of the week. So if you do have any questions, please feel free to email me.
Okay, sounds great. Thank you for having me today. It was very nice meeting you, and I'll keep in touch. Thank you. Have a great day.